they've hired these professional coaches, mentors, if you will, of a person who can be a sounding board, help guide them professionally, and also keep them on track so they feel like they're getting something. So it doesn't take resources from the practice, but it brings the coach in so that the employee that you've really identified as high potential gets that investment in them so that they feel like the practice is invested. Second thing, did this recently, we have a practice. Most of you out there have these same type of stories, but you got people that have been there 5, 20, 30 years. You know, we had an employee appreciation event, and we took those pictures and those recognitions of those 30-year employees or 10 years, and we started telling those stories to the other employees so they could see those opportunities for professional development.
Right.
Now we put them on LinkedIn. Now we take those same stories and put them in Glassdoor and on Indeed so potential hires see
when
it.
you're recruiting,
so you can foster that professional development.
Yeah.
Hey there, welcome to the Dr. Marketing Tips Show. I am Jennifer.
And I'm Corey.
And today we're going to talk about something that feels like we talk about it all the time, but it's so important, and that is really tips. I think there's 7 of them for really like developing your practices, culture, and engaging your employees.
Yeah, we do talk about that a lot, and the reason is it's so important. You know, there's so much turnover, and it's hard to keep people. I think that, you know, to be blunt, people will leave for an extra 25 cents an hour. We all know that. And so finding the right way to train, onboard, motivate, and then engage with your team, especially the new folks and the people that don't make a ton of money but handle and are really like the face of your practice to so many patients. So a lot of times we know that negative reviews, for example, usually it's not the providers. It's somebody at the front desk was rude. It's billing department doesn't have their act together, you know, things like that. So finding the right way to kind of keep everybody rowing in the right direction it's really the key to success.
You know, I think you hit the nail on the head there for across the board, but I will also say this. COVID wore a lot of people out.
Sure. And
there's been a tremendous amount of burnout, and, you know, just through attrition. I mean, doctors are retiring, employees are retiring, and we're getting that younger group coming through. I was with the practice this morning, and we're getting ready to do this. We used to focus a lot on cultural development and employee development with like senior level, or like the ones like the front desk girls or guys. And now we're doing a lot of like these middle level, the ones that came in through the front desk. They're mid-level managers. They've never actually managed people, but now they're getting ready to go into a leadership role.
You got to groom them
because of attrition. So we're having to like really focus on engagement. So it's interesting. Like I do a lot of ortho. I've spent a lot of time this past week talking about a culture program that we've put out this year that we're going to have we're going to recycle it next year with all new employees. We've got a fertility practice that we're doing some engagement with, and we've been talking to an ENT practice about doing some engagement. All things about like uptraining your employees, getting them ready in that mid-level career, and also teaching them like the basics, because you got people coming into healthcare that have never been there because we're dealing with still post-COVID, you know, burnout.
Right. Or, you know, one thing that we find too is like a lot of the HR folks. Well, I mean, really anyone that's training. Yeah, that's training like a new employee. New employee comes in, you train them to do their job, and you're so busy because of either burnout or reduced staff or, you know, whatever the case may be. So you train them to put widget A into widget B, and that's it. And so they never really get that larger picture to understand how they impact profitability and like their true value to the company, because they know that they have to come in, they know when their breaks are, when lunch is, and you know what I mean, like how to schedule time off and what they're supposed to do day to day. But they miss out on exactly what you were saying, the opportunity to lead and to grow and to know how everything that they do has so many ripple effects and how it impacts so many different things. So I think that's what we kind of wanted to talk about today is different ways that we can improve this culture and just help keep employees and keep them happy.
Absolutely.
So number one is prioritizing communication. So again, communication is really like one of the building blocks to creating that positive workplace culture, and part of that is just letting people know what's going on. And we see that in practices that we work with all the time where they there just is very little to no communication. There's not a standard way to do it, and people don't know what they don't know.
I think that you have like this old school communication, which is very important. The soft skills, we talk about that all the time. But we worked on a project this past year. You did. That was an enormous intranet project, which is one way that we're able, for this one practice, for them to communicate like in real time across the board to all their employees. And so I think sometimes we forget about that type of stuff.
Yeah, I mean, it's a practice of about 300 people. And we've tried a couple different things in the past. We used to have like an employee Facebook. That kind of worked, but not really, because not everybody's on Facebook, and you run into all sorts of issues with that. Before that, they used to send out like a memo, like literal like paper memo, but you can imagine that that is a nightmare. And again, not everybody picks those things up.
I laugh because people still do it.
I know, it's crazy. So the internet is a way to sort of standardize that communication, and we know everybody has access to it because it's literally the first thing that comes up on their computers. So they have to look at it.
Well, and I had a meeting this morning. So I'm part of a workforce development group for one of the practices we work with, and we're doing this kind of like cultural program, and it started with, and again, this one has about 350 employees, and they started with these town halls. And they were in person, and we had the wherewithal to go record them, which I think was great. So we recorded the town halls, but if you came as a new employee after the town hall, you wouldn't know. You didn't know. There was no way to communicate it. So now what we've done is we've built some automated communication for every new employee to go through the same level. So they're getting the same information whether they start 180 days after the initiative or one day before the initiative. And I think that's really important when we're talking about communication. How do you take the messages that that you're giving on a Monday and let the message that you're giving on Friday be the same message?
Yeah, and I think that's something that's super important too, because let's say you have a fantastic HR person, and
it's only one person.
It's only one person, and maybe one Monday she's just having a bad day, and so the group of employees that she's onboarding that day, they get a totally different impression of what it's like at your practice, because she has to do the same thing. It takes up, let's say, 4 hours of her day every Monday.
It does.
Right, and so one day something's going on. Is that group of 6 people, they're not getting the same experience. And I think another thing, before we jump off the communication idea here, is it's a two-way street. So everything that we talked about is sort of communicating at the employees. You also have to have a mechanism to where you can listen to what they have to say too. You actively solicit their thoughts and opinions, and that can be anything from like a committee to polls, surveys, whatever. But you have to do something to, it helps with engagement, sure, but they are the boots on the ground, so you shouldn't just be sort of making these decisions in a vacuum or in a committee with other physicians when you have like seriously no idea what's happening at the front desk. So
very good points, and it's all rolls up to communications. What's the second tip?
Second tip is to foster a team environment.
Couldn't agree more.
Yeah, so that's really encouraging teamwork and again, giving the opportunities for new employees to have mentorship programs or opportunities with previous employees, and just really to get to know each other instead of working in silos, which I think is something that every medical practice deals with.
Well, it kind of goes back to, back in the day, we had events. We had things, so we weren't as busy, so we were able to take time to get to know one another. But you can still do that stuff virtually.
Sure.
You can still do that stuff. I've got more and more practices asking for virtual lunch and learns or even in-person customer service training, things of that nature. Yeah, sure, it's a training, but it's also a chance to get people in a room, to take down the barriers, to bring down the walls and
makes
have
them feel like they're part of a team.
That's exactly the case. And then social media too. But I think internal social media. So like go back to that intranet you created. We have an entire section of that intranet that's nothing but opportunities to foster that development amongst one another. Somebody can post a question, somebody can answer the question, images of this is a team over here, this is a team over here, so people feel like they're getting to know each other, even if it's sometimes virtual.
Yeah, I know I worked with a plastic surgeon in the past, and I think like twice a year he would have these team building volunteer activities where like on a Saturday they would do like a Habitat for Humanity type activity. So, again, it's an opportunity for, even if you have a small team, for you to engage with the team, for the team to get to know one another and the physicians and the providers. Anything that you can do to kind of build that team environment, I think makes a big difference.
Agreed.
Yeah. All right, next tip. Provide opportunities for professional development. So that's basic idea there is that employees want to feel like they're growing in their roles or they're learning new things or they have the opportunity to move up. So you mentioned at the beginning, you're dealing with a lot of people now that they haven't managed people before, but now they're getting ready to step into that role. And so that's all professional development. And how do you foster that? So one, you have employees that stick around. And two, when they gain that sort of institutional knowledge, they have to give that back too. So I think it's like a two-way street. So you want them to be there and to be engaged and really kind of like take leadership and ownership of whatever they're doing. But I think it's a missed opportunity if you're not documenting all of the processes and the things that they are picking up along the way. Because if they start at the front desk, like you mentioned in your example, and then let's say it's 2 years later, now they're going to be managing people, they've got a ton of knowledge in their head. It's probably not written down anywhere.
Yeah, I think that's a really good point, and I have two pieces to add to that. One is we work with several practices who hire professional coaches. Not anything crazy, not talking about thousands and thousands of dollars. We're talking about a third-party person that can meet with your high potential employees or the ones that you're trying to foster that professional development give them an outlet.
Are those one-on-one meetings or team?
Nope, they do one-on-ones, and now most of those meetings are virtual, but they've hired these professional coaches, mentors, if you will, of a person who can be a sounding board, help guide them professionally, and also keep them on track so they feel like they're getting something. So it doesn't take resources from the practice, but it brings the coach in so that the employee that you've really identified as high potential gets that investment in them so that they feel like the practice is invested. Second thing, did this recently. We have a practice. Most of you out there have these same type of stories, but you got people that have been there 5, 20, 30 years. We had an employee appreciation event, and we took those pictures and those recognitions of those 30-year employees or 10 years, and we started telling those stories to the other employees so they could see those opportunities for professional development.
Right.
Now we put them on LinkedIn. Now we take those same stories and put them in Glassdoor and on Indeed so potential hires see
when
it.
You're recruiting,
so you can foster that professional development.
Yeah. That actually leads right into the next tip, which is recognize achievements.
There you go.
If someone has been around for 20 years, so I know that there's one group that we work with. We actually just did this, I think it was 6 weeks ago. They did an awards ceremony for everyone that's had some sort of big milestone.
Yep.
So 5, 10, 15, 20, whatever. And that is exactly what you're talking about, where we then take those stories and not only let the community know that this person has been here for 30 years, she's grown up with the
she
practice.
Started as a front desk, now she's the CFO.
Right, and that means so much, I think, again, from a recruitment standpoint and also a team building standpoint, but I think also to a patient. If they see that on your Facebook or your social media, and they say, wow, she's been there for 30 years. I mean, I always liked the doctor, but this seems like, it starts to ingratiate that this is a family-oriented, good place to be, good place to come to work, and that's a good place to go for healthcare.
Well, and we hear that from patients all the time, that they see the videos or see the comments about employees that have been there that long. We also, recognizing achievements, we use a software. And so we take our values. We have a couple of values at Insight, and one of them is get it done quickly and correctly or something to that effect. And we use our Slack channel, which could be your Teams channel, your chats or whatever, and we can award points to employees when they do something that is working towards one of our values. And so all day long you see people recognizing one another for a job well done or helping me out or whatever it is, and reinforcing our values of our company. Just another way to do it. It doesn't cost us anything. We were already spending that money rewarding people in a quiet way. Now we've done it where we involve everybody in that process.
Yeah, just adding to that. So how that works is the employees are rewarded, and then they basically put these points in a bank, and then they can go and redeem their points for gift cards, or we actually have custom swag, a little store built out so they can get a water bottle with the Insight logo on, a really nice one. Or there's different experiences that they can get if they get enough points, and we get a report. We can see who is recognizing who, which value is actually being used the most, or at least being recognized the most. So I think that's a really cool way to do that. And like you said, that money was already budgeted.
It was already being spent somewhere else.
Right.
Now we're involving everybody in it. So
Yep.
Good stuff.
Absolutely. All right, next one is encourage work-life balance.
Good luck with that.
Yeah, I know, that's easier said than done. But essentially, the idea there is employee burnout can lead to low morale, high turnover. So anytime that you can encourage that nice balance that we all sort of strive for, take that opportunity and do it. If an employee needs a personal day, okay. Don't make them feel guilty for it. And I think that's just a culture thing. And I see that a lot in smaller practices. Mm-hmm. Usually the larger practices, I don't know if they understand it more, but they are a little bit more structured in terms of
they're ready.
HR.
They can go with the flow. So
right.
They have backup people, whereas, if you called out and I called out, like, who the heck is going to do it?
Right, who's steering the ship?
But I will say, like, again, I go back to this meeting I had this morning with this workplace development group. One of the values that the practice has is talking about, like, the importance of timeliness, like being on time, and or quick response. And we were talking this morning about work-life balance, and how do you do that when there's this expectation, especially from patients or the physicians, that you better be on when I text you or call you. What is that expectation, especially younger generations, because you're expecting instant feedback from all of, like, our digital devices. But then you've got, is 24 hours is quick enough for it, things of that nature. And so I don't think you can have a conversation about work-life balance without having a conversation about the expectation. And then it goes back to communication. How do you communicate that expectation? Because we deal with it on our team all the time. Like, the expectation is I will get back to my clients right away. And that's my fault because I set that expectation, and it's somewhere in the middle, and it's
right.
about figuring it out. But it's not just, it's not just work-life balance. There's so much that goes with it.
Yeah, and it's funny, you mentioned, like, the younger generation wanting that expecting that immediate feedback. And they do, unless they're your employee. Because if they're your employee,
they expect to turn off their computer.
At 5 o'clock, they say, I'm home, I don't check my email anymore.
Yep. And I appreciate that. It's a cultural shift, though, and it's mm-hmm. not as easy as saying work-life balance.
Right. One of the practices that we work with, I know that for COVID, they sent everybody in their call center home, and they set them up, and they never came back because they didn't need to come back. They've used that office space now for a different department. And
storage.
Right. Well, yeah. And the call center is just spread out. They're just
yep.
home now. And so that, totally changed the dynamic of how that team was managed and how they actually, their workflow, how everything kind of comes together there. But again, going back to the younger generation, I think they, depending on the role, obviously, are going to expect some sort of hybrid model. And so how do you deal with that and then still have a really good, strong foundational culture?
Yep.
And that's one of the challenges, I think, not just medical practices, of course, but everyone is facing right now.
Yeah, absolutely. And I feel like I look at us because, we're about 15, 16 people now. And, for the most part, we're all remote. I mean, you and I are in the same room right now. We have like 2 or 3 other employees here. But for the most part, we've really, I feel like, strengthened the culture in the last couple of years. But you only can do that by being very intentional in that effort.
Absolutely. Which, great segue to the next one, is lead by example. So leadership sets the tone of the workplace culture. You mentioned earlier about how you kind of set the tone for the mm-hmm. immediate feedback, and now, again, since we've grown to 16 people, you can see the reverberations of that yep. and what that does to workflow. And so we're adjusting. We've found ways to still be efficient and still provide that great service, but not interrupt everybody's day. And so it's a moving target. I think,
it is, but it also goes back to the first thing we talked about, which is communication. Mm-hmm. You have to identify there's a problem, talk about the problem, come up with a policy and a procedure, and then stick to it and adjust.
Yeah, right. And when you have multiple providers at your practice, they wind up with a small team of their own anyway. So they've got like a patient care coordinator kind of thing. But I think even more than that, if they work with a particular X-ray tech or something all the time, that physician kind of becomes a little team leader, mm-hmm. whether they want that role or not.
Yep.
They are sort of put in that position, and everyone looks up to the person with the authority.
With the white coat.
Right. So if they are not trained, what kind of example does that set for their immediate team? And then, especially if you have multiple locations, if you're in 8-location practice, let's say you've got a branch manager, so then you've got a leader there who's setting by example. You've got your executive team leading by example. Then you've got your physicians doing the same thing. And there's just so many pockets of culture and people.
Yep.
And
it's very siloed, and you never know if they cross over. And so it's where being intentional matters so much.
It's crazy, and how each one of those things can affect employee well-being and just the general tenor of the organization can be influenced by so many different pockets. Anyway, that's a tangent that I had, but a thought. Okay, last topic, solicit employee feedback. So again, that goes back to kind of circling back up to number one, where it's a two-way street. And if you are not asking for feedback, then you're really doing yourself a disservice.
Agreed. And there's just so many tools right now, so many ways to get feedback that you got to meet the employee where they are and not expect them all to conform. But I'll go back to this. Just having a conversation, like face-to-face or pick up the phone, speaks volumes. And I feel like we've gotten away from that so much. But if you want to cut through all the BS and all the clutter and not hurt people's feelings, sometimes it's having that face-to-face conversation.
Yeah, it's funny. When I was younger, I was always against phone calls.
I remember.
Yeah.
But now it's just so much easier.
Yeah, I just wanted to text or Slack or type or something. And now I'm like, just pick up the phone. It's so much easier.
It's true.
And then when you sort of zoom out and kind of look at that from like a practice standpoint, have a lunch and learn or a focus group and have 20 people come into this thing and shut down the practice for half a day. And it doesn't have to be like that.
There's places for that.
Sure, absolutely.
But there's different ways to go about it. Sometimes it's as easy as picking up the phone.
Right, exactly. And so I think sometimes it can be, somewhat informal, kind of picking up the phone. Sometimes it's let's do an employee survey that gets sent out. They can do it on their time. They don't have to do it right now, which is great because then you can reach a lot of people.
And you might get different feedback.
They can be
different
anonymous.
Methods.
Yeah. And then sometimes it's let's get everybody together and do a town hall like you were talking about. So it's different strokes for different folks, but ultimately what we want to do is make sure that we're getting that feedback, and then the second part of that obviously is doing something with it. I know that in the past we have got different methods of collecting this feedback from practices, and then there's different levels of success in implementing what they say. Because there's bias there, and there's people that just say, well, that's dumb. And then it just goes away, and it didn't matter that you got the feedback in the first place. So once you get the feedback, then you actually have to have a process in place to go through it, coordinate it, implement it. I
think all of this to say that great culture is about being intentional, and really great culture starts with you. It's the person. It starts with you. It's the person at the top and the person at the bottom, and getting everybody on the same page. And when you're all on the same page and you're like ebbing and flowing together, you will automatically create that culture. Yep, absolutely. Yeah, and then if you do that, you're going to be able to attract and retain better talent, provide a better patient experience, and then we all win. Great stuff. So with that, I'm Jennifer. I'm Corey. See you next time on the Dr. Marketing Tips Show. Thanks a bunch. Bye, guys. If you want more like this, hit like and subscribe so you'll always be alerted to new episodes when they come out. And if you want information about us, visit us over at insightmg.com. That's insightmg.com. We'll see you on the next episode.